Hello, everyone. My name is Michael Hogue, President of the American Pharmacists Association. Thank you for joining us today at this important time in our nation's history. We would like to welcome all of you for this discussion. It's an open forum on addressing the COVID-19 crisis. This is intended to be interactive today. We will share some information with you, but we want your questions and your thoughts as we go through, and we'll do our best to answer those. Before I get started, I want to acknowledge the outstanding, tireless efforts of our nation's pharmacists, student pharmacists, and pharmacy technicians during the COVID-19 crisis. I have been inspired and impressed by the efforts that each of you have put forth in order to take care of the people in your communities. At the same time, sometimes risking your own safety from time to time to ensure that your patients have what they need. It really is a heroic story. With that said, I want us to move forward today because there's a lot for us to discuss. I do want to mention to you, as you've probably seen in writing in today's chat box, that we are recording today's webinar. It will be available to you shortly after we finish today's call, as well as separately the slides that we're using today, which will contain some important web links for you that hopefully you will find useful. So today we're going to focus our comments on the front end on the safety of pharmacists and pharmacy staff during the COVID-19 pandemic. As you all know, there are literally dozens of things we could talk about and need to talk about, but we want to focus today on safety of pharmacists and pharmacy staff because we know that that is top of mind for just about everyone. So let's get started with that. And as I've already introduced myself, I'm Michael Hogue, President of the American Pharmacists Association. I'm going to be your host and moderator today, and I'm joined today by Dr. Dan Zlot. Next slide, please. Dr. Zlot is Vice President of Professional Education at the American Pharmacists Association, and we've asked Dr. Zlot to join us today because Dan spent over 10 years on the staff at the National Institutes of Health at the NIH. He's an expert in immunology and oncology and has tremendous background and really understands COVID-19 very well from his clinical training. And so he's going to serve as our subject matter expert today when we get to our Q&A section. As you'll see on the next slide, our format for today's webinar is we're going to take about 10 to 15 minutes to just overview pharmacy safety issues and the current CDC recommendations so that you all know what is factual and we're making decisions based upon current fact. We'll spend about 15 minutes of time on Q&A that is focused on pharmacy safety issues, and I'll go over how that Q&A is going to work here in just a moment with you, but we'll make sure that you're aware of that. Then we're going to spend about 15 to 20 minutes with an open forum time. We're going to call it a minute for your thoughts, where you will each have the opportunity, as you desire, to share your experiences or thoughts that you think APhA needs to hear. And you'll be given a time to be able to do that as we move along in the webinar. And then at the end, we'll spend about 10 minutes wrapping up what APhA is currently doing and ongoing activities that are coming along. So let's move right into the next section. We are hearing a number of key things from pharmacists regarding safety of staff. There are many who are sharing with us that pharmacists and the staff in the community setting are being forgotten relative to being frontline providers who need supplies of personal protective equipment. So I want to take some time and address that today. We also are getting lots of questions about continuity of pharmacy operations in light of some of the self-quarantine recommendations that have been out there, and we want to hopefully provide a little bit of clarity around that today based on the current CDC recommendations. There's also questions about what happens if someone on your pharmacy staff is sick? When can they come back? What if someone on your pharmacy staff has been exposed to COVID-19? Can they work? We want to provide some clarity around that. We do have people asking questions about, for community pharmacists in particular, should I shut down the front end of the pharmacy? What do you recommend on this? So we'll talk a little bit about that. And regardless of where you're practicing, we'll talk about a few tips that we've gleaned on reducing exposure to COVID-19, but we also want to hear from you about your experiences and also talk about what you may be finding as important in relation to the field. So one thing I do want to point out immediately is that we're sharing information that's current as of today. You need to know the situation is evolving rapidly, and the CDC makes adjustments and changes to its recommendations on a regular basis. So it will be important, the resources that we share with you today are resources that you should check systematically and frequently in your practice to ensure that you're the most current as possible on these changes that are happening as it relates to COVID-19. Now let's start out first with just a real quick definition of what is personal protective equipment. Personal protective equipment is defined by OSHA actually, and it's any equipment that's used to minimize your exposure to a hazard. And that could be any hazard, but in this case, of course, we're talking about COVID-19. So gowns and gloves and are great examples of PPE. Masks are great examples of PPE. Depending on your setting, of course, hats and other things might also be. But in this case, we're talking specifically about gowns, gloves, and masks in terms of the different areas of pharmacy practice. And so that's what PPE is defined as very broadly. And I would just encourage you to keep that in mind. The term PPE does not just singularly mean masks. It means gloves and masks and anything that you use to be able to protect yourself from the threat of the infectious agent, in this case, COVID-19. Now we'll go to the next slide. I want to just mention to you, we're not going to spend any time on this today, but when you see the version of the slides posted after today's webinar, I've included in the version that you'll have access to later, a series of slides about OSHA. OSHA does, in fact, have a role to play in COVID-19 because OSHA is concerned with occupational exposure to various infectious agents. And they have published COVID-19 occupational exposure rules and regulations and what is expected. And so employers do have to provide a workplace that's free from recognized hazards that could cause serious harm or death. And that includes from COVID-19. So if you are an employer and you have not taken a look at OSHA's role in COVID-19, I would urge you to take time to investigate what OSHA has to say about COVID-19. There's nothing in OSHA's regulations that contradict the CDC's guidelines, I will say that, but you all do need to be very, very aware that OSHA does have roles and responsibilities that they expect for people to be able to adhere to. Next slide. Now, currently, I want to talk about what is current as of today as it relates to personal protective equipment and healthcare providers. I want to talk about face masks. We all know that face masks are in short supply. That's a pretty obvious thing for all of us, regardless of the practice setting that you're working in as a pharmacist. The CDC does allow for limited reuse of face mask, which means using the same face mask with the same healthcare provider in multiple encounters with different patients, but you remove it after each encounter. So if, for example, you are providing patient consultation in your pharmacy or you're seeing patients in the hospital at the bedside, you would use the same face mask. You would take it off appropriately and remove it if between patients to ensure that you're maintaining safety. You do need to know that as a healthcare provider, if you're taking off a mask and you're reusing it, it's important that you take special care not to touch the outer surface of the mask when you remove it. And when you do remove it between patients, be very deliberate and intentional and careful about removing the mask. And then if it needs to be stored overnight for use on another day, put it in a plastic bag to store it. I never thought we'd get to the point that we had to reuse face masks, but this is actually happening in places where there are shortages, and you need to use best practices. Notice at the bottom of this slide is a link that you can follow after the webinar to get very detailed instructions about what to do if a face mask needs to be reused because you have a lack of access to a number of face masks. If these face masks are soiled or damaged or you can't breathe through them, then you got to throw them away. And not every face mask can be reused. There are certain ones that are not suitable for reuse, so you need to pay attention to that. And also be sure that you remove yourself from the patient care area before you reuse the face mask. Next slide. You should also know that the CDC does have some guidelines on healthcare providers and distributing masks. So I know many of you have been frustrated that pharmacists and pharmacies have had a difficult time accessing face masks and getting them from your suppliers. You need to know that part of the reason for that is that the prioritization of the distribution of face masks is that people who are having essential surgeries, in other words, for hospital use and procedures in hospitals, or any activity where splashes and sprays are anticipated, like with emergency dental procedures, or places where there's prolonged face-to-face contact with an infectious patient, it's unavoidable. Those are the places where there's prioritization. I will tell you that APhA is working diligently with the CDC to ensure that pharmacists are appropriately prioritized for face mask distribution and for use of face masks. And so you need to know that we're working on that. We are aware that it's an issue, but just to help you understand the prioritization. The next thing I want to talk about on the next slide is that you've heard that there are different kinds of face masks. N95 respirators are the gold standard in infection control. And so everybody's been talking about N95 face masks. Those are the ones that are in the absolute shortest supply right now. The CDC has published a checklist to determine who should be receiving N95 respirators based upon risk. And so these are checklists that healthcare facilities can use, including pharmacies, to optimize the supply of N95 respirators that you have. It's unlikely that every single person in a healthcare facility, including a pharmacy, would need to be wearing an N95 respirator, but some people may. And so this checklist is designed to help you determine whether or not the individuals in your pharmacy or in your practice need to be using N95 respirators. And so I would urge you to take a look at that when you get finished with today's webinar at the link that we've provided you. Next slide. Now, all of the recommendations that the CDC makes on control and helping healthcare providers know how to deal, excuse me, with patients who are COVID-19 positive and how you as healthcare providers can protect yourselves. Those recommendations are updated on this web page that we've given you a screenshot here and provided the link. Let me encourage each of you in your practice to have someone within your practice be responsible for checking this website on a daily basis to determine, excuse me, I apologize for my voice, to determine if there are any changes that are necessary or that any changes that have happened by the CDC. So pay attention to that. On the next slide, I also want to mention to you that we're using the term healthcare personnel. You will see that term used frequently throughout the healthcare documents of CDC. And I want to point this out because what the CDC means by healthcare personnel is anyone who's serving in a healthcare setting who has the potential for direct or indirect exposure to patients or infectious material. This is literally anyone. For those of you who are in community pharmacy practice, this is literally anyone in your pharmacy who has contact with patients or with the material patients are providing. And this is an inclusive for the health system and hospital environment, includes the cleaning staff and other people. So healthcare personnel is a broad term that you need to be aware of. Now, the last thing I want to talk about here in terms of the CDC is on the next slide, and that is we're going to talk about what you should do in the next few slides in terms of exposures that might happen in your pharmacies. For pharmacists and pharmacies, the operations center at the CDC is available. The number is provided here. If you have difficulty doing risk assessment and determining what to do in your practice, you can call the Emergency Ops Center. This is not a consumer line. It's not available for consumers, only for healthcare facilities. And so as a pharmacy, if you have a question that we're unable to answer today and you need guidance from the CDC, you can contact them. Okay, quickly, I want to go through just a couple more slides and then we're going to start taking your questions. What can you do in a community pharmacy to protect yourself? Well, several tips have been given. I'll point out that we are advising you not to accept paper prescriptions, electronic and telephone only, not accepting patient bottles for refills, call-ins only. We will tell you that CMS has suspended Part D plan signature requirements, and Elisa will discuss that at the end of today's call. We encourage you to think about using credit card versus debit card so that there's no PIN input necessary. Washing hands frequently for 20 seconds with each washing, or using hand sanitizer between patients and between transactions. And then, of course, using plastic shields at cash registers or clear shower curtains have been suggested as creating a shield. It doesn't have to be a hard plastic shield, but something to prevent a patient from sneezing or coughing on your personnel. What else can you do? You maximize the use of drive-throughs. We encourage delivery personnel to wear gloves, call the recipient when they're outside, and leave the medicine at the door, and then try to make sure that the recipient gets the medicine before driving away in order to prevent theft. Immunization should proceed. Immunizing pharmacists should don personal protective equipment when administering vaccines. There's pretty good data that tells us that influenza and pneumococcal infection, secondary infection with COVID-19 does cause serious secondary infection. And so we want to vaccinate with flu vaccine and pneumococcal vaccine to help prevent more serious outcomes, adverse outcomes in these COVID-19 patients. And then, of course, maintaining social distancing, and use social distancing not only with the patients, but also with your staff to ensure that that's the case. On the next slide, I just want to point out that there is guidance on what to do if a member of your pharmacy staff is diagnosed with COVID-19 or exposed. There's been many questions about this. And the questions really rely on, do I need to close down my pharmacy if someone in my pharmacy staff is diagnosed with COVID-19? Well, the quick answer to that on the next slide is no. You don't necessarily have to shut down your pharmacy. And I know a lot of you are worried about that, especially in community pharmacies. There is a step-by-step process of categorizing risk. Step one is that symptomatic individuals should not work and should self-quarantine. So anyone who has a fever, a new onset sore throat, new onset cough, or new onset shortness of breath should not come to work as soon as they recognize symptoms. Now, we know that people do spread the virus prior to the development of symptoms, but when symptoms are present, that certainly is an indication that you should not come to work. On the next step, then you have to systematically assess each individual who was working with the individual who was diagnosed. In most cases, we're looking at stratifying people by high risk, medium risk, or low risk. And I don't have time in today's call to get into the details of how you do the stratification, but that previous list, that link that I provided a couple slides ago, has detailed instructions on how to do a risk assessment to determine who's at high risk, medium risk, and low risk. And included in those recommendations tell you exactly what you need to do. So for step 3, if we have someone who is at a medium or high risk, who's had a medium or high risk exposure, we do self-monitoring or self-monitoring with delegation, which means that the staff member's temperature has to be taken prior to starting work and entering a facility. The staff member's temperature should be taken again mid-shift, so twice daily monitoring. Anyone who develops new symptoms has to withdraw from work, but anybody who's asymptomatic can continue to work with continuous monitoring if masks were used. And so that's a big important piece there for this step. So again, next slide, there's a risk stratification assessment table. I would urge you to take a look at that and familiarize yourself with it. Okay, with that, we're going to do a quick polling question. And the polling question that'll pop up on your screen here is your hospital, clinic, or pharmacy providing sufficient PPE for your pharmacists and staff? So we'll get your answers. Please respond quickly. All right, Brian. All right, it looks like about 38% of you are not working in an environment where this is an issue. 37% say that no, you're not being provided with PPE, and a quarter of you say that yes, you are being provided with PPE. That's good information for us to have. Now, I want to begin our open forum, and I want to give you some ground rules. Use the questions field on the GoToWebinar toolbar that you'll see on the right-hand side of your screen to submit comments and questions related to the topic that we're talking about today, which is personal protective equipment and keeping your pharmacy staff safe. I will look through these questions, and then I will give you the opportunity to ask your question out loud. In order to maximize the number of questions or comments that we were able to receive today, once we've opened your line will only be open for 60 seconds to give your comment or ask your question, and the line will automatically close at the end of 60 seconds. That's not us trying to be rude, it's just trying to ensure we cover as much as we can and get as many of your questions answered today as possible. So we're going to start on, first of all, questions, comments, and feedback on the safety of PPE. And to get us started, I'm going to ask Dr. Zlot to answer a question that we got from many of you well in advance of today's call, which is really about prevention and treatment both. Dr. Zlot, there have been a lot of questions submitted before today's webinar on the topic of preventive medications and treatments for COVID-19. What works, what doesn't, what do we know about the supply of these drugs in the future, such as hydroxychloroquine? I know we can't get into this in great detail, we don't have time to do that, but maybe you could give us just a real quick overview and then tell us about APHA's efforts on educational programming for pharmacists on this topic. Dan?
Thank you, Michael. Well, good afternoon, everyone. So I'm going to run through a bunch of options very quickly, and I apologize for the brevity of this. I won't be able to do it justice, but we do have some training that I'll tell you about at the end where you can get more information. I think the drug combination that all of us have been hearing a lot about is chloroquine or hydroxychloroquine, possibly in addition to azithromycin. So there's really strong laboratory data surrounding this combination and some good emerging clinical evidence that this may be effective in the treatment of COVID-19. However, data are extremely limited, and the trials to date have significant limitations. The trial that has the best data, to give you an idea, only has 42 patients in it total. And of those 42, only 26 got hydroxychloroquine, and only 6 of those patients got the combination of hydroxychloroquine and azithromycin. That's what's generating all the buzz around this. So that's one option. Another option that's been looked at is lopinavir, ritonavir, Kaletra. And initial data with that combination was promising, but more recent data have actually been pretty disappointing. Trials showed no difference between the control and the Kaletra arm. And so that's something that doesn't look like it's going to bear fruit. Another drug that's being looked at is remdesivir. This is an investigational drug, and it was developed for the Ebola virus, actually, back in 2016, and has shown great laboratory activity against COVID-19. Early studies are showing some good clinical outcomes. However, this is it's an investigational agent only, so it's not readily available. The last drug that you may start hearing a little bit about is nitazoxanide. Nitazoxanide has been looked at for flu and actually showed some interesting, some potentially positive data for flu. And right now they're looking at it in vitro, so in the lab only for COVID-19. It's shown some promising results there. The clinical experiences with nitazoxanide are just getting started, and there's really no data there yet. So that's kind of what we know about efficacy so far. And so the second part of your question was about what do we know about the supply of these drugs? As you all are no doubt seeing, there are supply challenges already with chloroquine, hydroxychloroquine, and possibly soon azithromycin. And so one of the things that APhA is doing, and I'll let Elisa talk more about this later on, but we've partnered with the American Medical Association and the American Society of Health System Pharmacists to put out a statement discouraging inappropriate prescribing by physicians for personal use, for family use, et cetera. So that's one thing that we're doing. And again, I'll let Elisa talk more about that later. Her team really led that effort. And so I think that covers everything in a nutshell. I apologize for the brevity. There's just so much information involving here.
Now that's great, and we'll be sharing information with you a little bit later on about how you can access more in-depth coverage of this topic from APhA. So we'll share that a little bit later on. I want to open up Chelsea Baker's line, staff, if we could do that. Chelsea, you've got a question about pharmacy staff and underlying conditions. Would you like to ask your question?
Okay, her line is open.
Okay, Chelsea, your line is open. Chelsea? All right, well, we can't seem to get her in, but I think I see her question here. What are individuals doing if a member of your pharmacy staff has an underlying immunocompromising condition or some reason that might put them at a high risk? Dr. Zlot, what are your recommendations on that?
Sure, that's a great question, and potentially a difficult one. There's a lot of considerations there. So I'll try to answer this as carefully as I can. First and foremost, I think, is the protection of employees and the protection of self and family. Patients and workers who are at risk, need to be afforded extra protections. And so, ideally, best case scenario would be to avoid situations where you're exposed. I realize that is not always possible, and corporate policy and HR policy has a lot to say about that as well. And so there's a lot of considerations around that. I would suggest as well, so if those people have to come to work in order to continue to be paid, or because of, again, HR policies with your particular company, I would strongly suggest that those folks be prioritized for PPE, and then that they also do their best to maintain appropriate social distancing. Wherever possible in your pharmacy workflow, again, it depends on who the individuals are and what your staffing levels look like. Minimize these individuals' interactions with the public to the greatest extent that you can. I know that's incredibly challenging, and depending again on staffing workflows, that may not be possible, but these are the folks we want to give the most opportunities to protect themselves and limit their exposure. So that's what I would say. I don't know, Michael, if you have anything else to add.
No, that's great. I appreciate that. I think the main thing is, we want to certainly do all that we can to be very careful with this. And so the other thing I want to point out is that we're giving you today the national guidelines from CDC and the perspectives that the CDC is offering on how we should approach these issues. All of you are aware, I'm sure, that state and county and local health authorities may in fact have more stringent requirements or requirements that must be followed in your local areas. And so we just want to urge you. I know this is a lot to keep up with. We'll do our best to keep you up on what's going on at the national level, but be aware that there may be, in some cases, more stringent requirements that you have to follow, and that could be different from a city or a county level. And we've gotten a couple comments from participants saying that their county or their city has slightly more stringent requirements, and I just want to add that in. We've got several questions coming in, Dan, about COVID-19 testing and pharmacists' involvement, and can pharmacies and pharmacists be involved in COVID-19 testing? Can you speak a little bit about that and what is going on? And in fact, we may want to get APhA involved in that conversation as well. So maybe Dan and APhA both could be unmuted so that they can both give some insights into that.
Absolutely. So I'll kick it off, and then I'll hand it over to APhA to clean up anything that I said that's either incorrect or incomplete. So when we talk about COVID-19 testing, generally there are, I would break it down into two categories of COVID-19 testing. There's PCR-based testing, where we're probing directly for viral RNA. And then there's immunoglobulin-based testing, where we're looking for an immune response to the virus. And so each of those has different ways of administering the test. And so this is a field that's evolving very rapidly as well. You've seen a lot in the news about how quickly we're trying to develop new technologies around testing. And we at APhA believe strongly that pharmacists can play a role in this and should play a role in this. I know a number of states have declared emergency rules allowing pharmacists to participate in this testing and perform point of care testing. And some states are even considering allowing pharmacists to initiate drug therapy based on testing results. And so there's, again, it's a rapidly evolving situation there. In terms, one of the key things about testing is to ensure that you have proper training. Regardless of what testing device you use, right now the most common type of testing is the collection of a nasopharyngeal swab, and that requires a special technique to ensure that you collect an adequate sample. New testing technology is coming out that might allow for nasal swabs instead of the full nasopharyngeal, where you have to stick the swab really deep into the nose until you hit the back of the throat. Potentially oral pharyngeal swabs as well, a much easier technique. And then some of the immunoglobulin-based testing are point-of-care tests, almost like a glucometer. And so you put a drop of blood on the test, and then you get a result based on the immunoglobulin staining. So it's important to understand how to use the test. APhA has been working with a number of partners to be able to stand up some training on how to use these tests appropriately, as well as what types of personal protective equipment are required when you're performing these tests and how to use it. It's a step beyond even what you might encounter in a normal pharmacy. Obviously, you have much more contact with the patient when you're collecting one of these specimens. So that's my half of the answer. APhA, I'll turn it over to you.
Sure, thank you. Yeah, so in addition to what Dan was saying, that a number of states are passing orders and declarations and regulations covering COVID testing by pharmacists. Most recently, over the weekend, in the last several days, APhA has worked side by side with other national pharmacy organizations to try to get provider status in the legislation that you've been hearing about, that the Senate passed yesterday and the House is going to be passing tomorrow. Unfortunately, included in there was we were trying to get coverage for and inclusion of pharmacist testing And unfortunately, it didn't get in this bill, but we're going to keep trying and hope that it will get in there in the next opportunity.
All right, well, thanks for that update on the testing. And I'd like to ask the staff to unmute the line of, sorry, we got lots of questions here, of Richard Dang. He has a question about pregnant personnel. Could we unmute Richard's line and get his comment, please?
His line is open.
Hi, thank you, President. So my question was, would you consider pregnant personnel to be in the same high-risk group as those who are immunocompromised, and what precautions should we take to protect those who are pregnant?
APHA.
Hey, Richard. Thanks for the question. That's a great question, and one that is a little bit unknown. To my knowledge, I have not seen a lot of data out there about the risk of pregnant women or breastfeeding women when it comes to COVID-19 disease. And so I think just out of general precautions, many are grouping them in with the immunocompromised group just out of an abundance of caution. That's really based on an abundance of caution. To my knowledge, I haven't seen any data about increased risk factors to the fetus or to the mother. And so it really is one of those unknowns. And I would say that in terms of practice, if possible, again, I think it would be advisable to treat them as an immunocompromised individual. That is my opinion, and not necessarily A, doesn't reflect the opinion of APHA, and B, does not reflect any available data that I've seen.
Okay. All right, now we're going to shift and not just talk about PPE and safety. We're going to just shift over to allowing folks to just comment on any topic related to COVID-19 that you'd like to, if you have information that you'd like to provide, comments that you'd like to provide that you think your colleagues might benefit from, or any other questions you'd like to ask. We're going to start by unmuting the line of Yoshio Ho. Yoshio Ho has a question about volunteers. And so, Yoshio, we're going to unmute your line.
Hi, can you hear me?
Yes, we can hear you.
Oh, super. So actually, I'm a consultant pharmacist. I'm actually a prior authorization pharmacist, and we're doing things to help our clients to get medications such as early refills and 90-day supply. However, I do feel a little bit out of touch in the community, and I was wondering, is there a need for pharmacists as healthcare providers in the community that you've heard that I can help?
So you're asking about volunteerism. Is that what you're asking about?
Yes.
Yeah, we have gotten lots of requests from student pharmacists and pharmacists about opportunities to volunteer. I would just ask that anyone on the call from APHA staff, do you have suggestions for Yoshio? I have a few that really don't necessarily relate directly to medications, but there are a lot of things in the community that we can do, including delivery services, helping with Meals on Wheels, and getting seniors food. And food insecurity is a big problem. And then also just assisting other healthcare providers across covering shifts and helping with child care and other things. But let me open that up to Mitch Rotholtz or anyone on the APHA staff who wants to chime in on your ideas and suggestions.
So great question. One source that we encourage you to make contact with is your local state pharmacy association, who may be keeping a list of practices that need additional assistance. So as Michael said, there's multiple roles that we're hearing that people are needing assistance in, even just to get a break and relief, or talking to patients at curbside. There are numerous ways in there, as well as in your local communities. There might be, through your public health department, some identified needs as well. We also will be putting out some additional information shortly about other volunteer opportunities and ways of engaging.
Great. Let's unmute Stephanie McGrath's line, please. Stephanie, could you offer your comment on this topic?
Okay, 1 second. Let me get her line.
Okay, Stephanie.
Okay, Stephanie, your line. It says self-muted. Let's try one more time.
Unmuted on your end.
Hi, good afternoon.
We got you. We can hear.
Great, thank you. I just wanted to offer on the COVID best practices website, there's a link for community pharmacies who are interested in being matched with available student pharmacists across the country. There's a jot form that you can fill out to put an ask out there for student pharmacists across the country. So I included the website in the chat box, so maybe that could be pushed out.
That's great. Thank you so much for that feedback. That's very helpful. Could we unmute the line of Michael Murphy? He's got some ideas about ways pharmacists can help during this crisis that are indirectly related to COVID-19. Michael, would you like to make your comment?
His line's open.
Sure. Thanks, Michael. I have noticed several policy think tanks publishing recommendations to allow pharmacists to test and treat for flu and strep to help unburden the healthcare system so that pharmacists can use practices that are well known and utilized in other states to allow other providers to focus on COVID-19.
Okay, great. Good feedback there. We're going to shift topics quickly back and forth to multiple topics, try to cover as much as we can. Sean Jeffrey, how about your comment about some requests of your health system from the health system pharmacy side?
Hey, Michael, thank you very much. This came through our care management team. They were looking for a list of medications that cause immunosuppression, and come to find out that's not an easily accessible list unless others know where you can find it. So we started to compile that, thinking it might be useful for APhA to also have this list handy so that they can screen some of these patients who are being brought in for other drugs that may be adversely affecting their immune system.
Okay, great. Thanks, Sean, for that. Appreciate that comment. Let's take a look here. Comment from Jeffrey Bratberg. Can we open Jeff's line? He's got a suggestion for volunteering.
Stand by. Jeff, your line's open.
All right. Hi. Thanks. Yeah, it's also important. I've been a member of the Rhode Island and Medical Reserve Corps. They have many chapters nationwide. It should be an easy way to contact them and sign up as a medical volunteer and work with other professionals to help out. Look them up.
Great. Medical Reserve Corps, that's a great idea. Thank you to you and Lisa Schlotz, who also brought that same suggestion to us. I appreciate that very much. Okay, how about let's have Kaylin Bowman. Kaylin Bowman has got a question, a clinical question for Dan Zlot. Kaylin, could we open your line and get your question for Dan?
Line's open.
Kaylin, your line's open. Be sure you're unmuted. We can't hear you. Kaylin? Well, maybe she's dropped away. We can't hear her. The question is, once infected and then recovered, are persons still contagious? And do they have lifelong immunity against COVID-19? So that's the question from Kaylin Bowman. Dan, can you respond to that?
Sure, absolutely. So what we know so far in terms of once infected and then recovered, are people contagious? What we know about the presence of viral RNA is that once infected, a patient you're able to detect viral RNA in the nasal passages of patients for 20 days after they've been confirmed positive. Now, some caveats there. It's unclear if the presence of viral RNA is the same as actually being able to shed infectious viral particles. Those two are not necessarily the same, but to be safe, I would say that an average of 20 days is about the infectious period. And again, that's making an assumption. So do realize that. The second half of the question about, are you protected for life after you are infected with COVID-19? The answer is it's too early to tell. There are news stories out there that people have been reinfected, and I take news stories with a gigantic grain of salt because they're news stories. I have not seen case reports yet in the clinical literature of patients being reinfected with COVID-19. It doesn't mean it's not happening. It just means I haven't seen it in the clinical literature. The other portion of the question is how long do you have immunity from this? And again, the answer is it's too soon to tell. As you all know, some diseases, once you have them, you do develop lifelong immunity. Others, the immunity can fade over time and may require frequent exposure in order to continue your immunity. A good example of that would be tetanus, right? That's why we re-immunize ourselves every 10 years against tetanus toxoid. So it's too soon to tell when it comes to how long the immunity will last.
All right, that's great. Let's see here. We've got time for a couple more questions and some information that we want to be sure that we share with everybody. Let's look here. Anna Kablowski has a comment about N95 masks and storing them, and tips about how to appropriately store them, or thoughts on that. Anna, do you want to share that with us?
Yes.
Mine's open.
Can you hear me?
Yep.
Okay. Yeah, my husband works in a ER also, and again, like everybody else, like all of us, we're don't have enough masks, and they've been telling their staff to hang them in the sun after working so many hours. Is there any information on how long this UV exposure is needed to be able to clean up the masks?
That's a great question. Not to my knowledge. And this is one of those things where everyone's trying to figure out the best thing to do. Whether there's sufficient UV exposure from sunlight to effectively destroy the virus and the viral DNA, or RNA, I should say. COVID-19 is an RNA-based virus, in case you're curious about that. That's unknown. The other question that comes up is, what does intense UV exposure do to the materials of the mask? Also an unknown, unless the specific manufacturer of the mask has that data available. Some may. So one of the first things I would do is check with the manufacturer of your mask and see if they have that. The last thing we want to do is, compromise the protection that we think we're getting from the equipment because of improper handling. And so I don't have that information available, and I've not seen much data about it.
Okay.
And Amanda Applegate, who is online, would like to unmute your line. She has a response to this question as well. Amanda, we're going to unmute your line so you can give your comment.
Line's unmuted.
Yes, so the University of Tennessee, the gentleman who developed the electrostatic technology in a lot of the N95s published some guidelines on that today. I did send the link to staff who can hopefully add that to that. But basically, they advise utilizing steam, such as from a steam iron, boiling the masks, or heating them in an oven.
Okay, thank you very much for that information, and we'll take that information in the link and add it to the resources that we have available. Okay, we've had many questions from many different people about the recommendations in today's webinar being shared with large corporate employers of pharmacists. The APhA will in fact share the information, both the recorded version of the webinar with our corporate friends, and let them also hear some of the latest breaking. They're in touch with our staff as well. So we'll make sure that that's shared. I just want to reassure everybody that APhA is working on that. We're aware of it, and we're on it. I'm going to take one last question because of time, and then I've got several important things, so don't leave the webinar yet. We've got several other important pieces of information to share with you, but I want to take one more question. Chris Federico has a question about gloves, and I'd like to have him ask that question since it's directly related to today's core topic of safety. So Chris, we'll unmute your line so you can ask your question that's related to gloves.
Chris, you're self-muted. If you just turn off on your side. The message coming back is Chris is self-muted.
Okay, Chris, your phone is self-muted. Let me give you one more chance here to see if you're live. No. Okay, well, I'll ask your question for you. It's if a staff member is wearing gloves, should we encourage glove removal after handling each item or disinfecting with alcohol afterwards, or do we want to change gloves between patients? If changing gloves is recommended, wouldn't this practice worsen PPE supply? What's recommended related to gloves? So we've talked a lot about masks today, but we've not spent a lot of time talking about gloves. I know, Dan, when I go to the grocery store, the grocery clerk is wearing gloves and they don't change them between customers as at the grocery store. But what about in the pharmacy? Should we be doing something different? What do you recommend on this, Dan?
So a great question, and I think also a very difficult one to answer as well. Ideally, so I'll give you an ideal answer, and then I'll give you maybe what you might have to do. I'll kind of split those up. Ideally, you'd want to change gloves in between each interaction with patients. If you had an unlimited supply of gloves, that would be ideal. Keep in mind that gloves are really no different than your skin. It's just that you can remove them quickly, right? So gloves can become contaminated just like your skin can become contaminated. And so as soon as you touch something, those gloves are no longer clean. And the next thing you touch with those gloves, you're going to be spreading whatever you picked up, just as you would with your skin. And so that's the ideal answer. So in the absence of unlimited personal protective equipment, I would recommend frequent sanitization of gloves with hand sanitizer or isopropyl alcohol. So I don't know if any of you have sterile compounding experience, but this is a frequent practice that we see in the clean room. In between touching items, as you come out of the hood and go back in, you need to clean your gloves with sterile isopropyl alcohol to basically decontaminate them or disinfect them. And so I would recommend the same practice as much as possible. That will extend the life of gloves to some extent. Of course, if they become visibly soiled, it's time to change them. And of course, if they develop a puncture or a tear, it's time to change them.
Okay, well, I want to progress on. I want to introduce to you all the next slide, Elisa Bernstein. And Elisa is the Senior Vice President of Pharmacy Practice and Government Affairs at APhA. She's going to share with you some of the things that are ongoing activities at APhA and a few things that are coming quickly. So, Elisa, if you could take about 3 to 4 minutes to just share with us a few of the things that are going on at APhA.
Great, thanks. Great discussion so far. If you could go to the next slide, please. Oh, here, well, I'll start with this one. I'm sorry. We have a series, we've been putting out a series of APhA's 15 on COVID-19 series of educational trainings. They are available on our website. So far, 2 have been launched. The third one will be on Friday. The first was on anti-malarials. Then the second was a general COVID overview. And the third one is going to be more of a dive into non-steroidal and in COVID-19. So I'm going to just kind of breeze through some things here in terms of what APhA has been doing for you and Pharmacists. And a lot of this information is on our website. So because time is short, what's on the slide here is on March 20th, 11 national pharmacy organizations joined together to create a joint set of policy recommendations that are critical to addressing the COVID-19 pandemic. as this pandemic puts an enormous strain on our nation's healthcare system, and the supply of healthcare providers are limited, increasingly limited, we as pharmacists, we're trained, we're knowledgeable, we're experts, and we can jump in and fill this void. And so what we did is we put together recommendations directed to policymakers in Congress, in CMS, FDA, DEA, HHS, and the private sector for actions that they could take to empower pharmacists to really fully and effectively support our nation's response. And there are a number of policy recommendations in here that fall into these 4 buckets that are on the screen. I just want to mention quickly the first one is authorization to test, treat, and immunize, which is, we talked about, there was a question today about that. And so this is really getting pharmacists more engaged and the authority in order to do that, as well as addressing drug shortages, decreasing barriers for us to do our job better and more efficiently, and then decreasing reimbursement for barriers for reimbursement. So the next slide, just to share, just yesterday, APHA's Board of Trustees issued a statement in response to those mounting concerns about inappropriate ordering, prescribing, and dispensing of medications and medical supplies, you know, that is exasperating and creating drug shortages and jeopardizing patient care. So you've heard about hydroxychloroquine and chloroquine and the azithromycin issues. We have heard about prescribing of large quantities of medications that are being studied for families and friends and patients and stockpiling, and this is unacceptable. It's led to shortages of these products, and they're not available for people who need them for lupus and rheumatoid arthritis. So this statement calls this out and recognizes pharmacists' autonomy and professional judgment and being stewards of medicines and medical supplies. So in addition to the APHA Board of Trustees issuing a statement, also yesterday, APHA, along with AMA and ASHP, issued a joint statement to further address this issue and specifically opposing this activity. That's on our website. Last week, APHA issued a statement directed to patients and caregivers, giving guidance to ensure that they have enough medication if they can't get to the pharmacy, and to talk to the pharmacists about concerns. You know, we as pharmacists need to manage this and prevent hoarding and stockpiling, and so that was targeted for specifically to patients. Next to the next slide, as we've been talking here, and you've been identifying that pharmacist safety is paramount, and APHA has and will continue to advocate on your behalf. We've heard that pharmacists, as you've been hearing, you know, have no gloves or masks and working in unsafe conditions. So on March 17th, we issued a statement recognizing the urgency to ensure that pharmacists have appropriate safeguards. As we all know, we're frontline providers. And so we as APHA are advocating on your behalf to policymakers, public health officials, to have them include pharmacists in PPE allocations, and calling on the private sector to incorporate procedures and policies to minimize pharmacist exposure and address the patient safety issues. Next slide. Also new, we have launched a new APHA Engage community called Identified for Pharmacy Response to COVID, as a place to share questions, resources, and lessons learned. Go there, sign up. It's a place that you can make APHA aware of experiences and issues that we can use in our advocacy and outreach. And also, please, also on the slide is our pharmacist guide to coronavirus resources. We continuously update this. It's loaded with useful information and links. We are also, we are continuing to watch the stimulus bill that passed in the Senate last night. There are a number of provisions that impact pharmacists, drugs, and our services. And so we're analyzing the bill, and stay tuned for more of that. There are many issues that we're working on for you. Check out, again, pharmacist.com, and follow APHA on Twitter, Facebook, and LinkedIn to get the latest information. I think that's it for me.
All
in
right.
one breath.
Thank you so much, Elisa. Well, I just want to give you all next steps. We're going to, first of all, we're recorded today's webinar. As we've told you, we're going to be posting that at pharmacist.com/coronavirus within 24 hours. We will be doing these webinars weekly. Next week's webinar will be announced tomorrow, Friday, and then it'll be in the new weekly COVID-19 newsletter and the APHA Engage communities, both that go out to APHA members. So look for that in the COVID-19 newsletter for members and the APHA Engage community. If you're not a member of APHA, I would encourage you to join. Now is the right time to do that, to stay connected to what's going on with this issue. We'll be back next week, same time, same place, Thursday, April the 2nd from 1 to 2 p.m. Eastern time. And we hope that all of you can join us for that. In the meantime, we wish you well and the best safety and health in the coming days. And we will be sharing more and more information as it becomes available. Thank you all. Have a great day.